Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of Chain Drug Review and Mass Market Retailers. Welcome to our video forum. Today, we're thrilled to have as our guest Dominique, a partner at the consulting firm Kearney. Kearney and Chain Drug Review are preparing for their third annual Health Equity Summit in October 17th in Chicago, and we thought it'd be a great time to get your thoughts on this important issue.
Absolutely.
Maybe to begin, you could tell our audience what to expect on October 17th.
Yeah, great question. And Jeff, thanks for having me today. We're excited to be co-hosting the summit with you for the third year. It's a passion project of myself, but also just a huge, I would say, important initiative for the firm. And so for this summit, in terms of what people can expect, it's designed to bring together executives and community leaders from across industry, as well as innovators and whatnot from locally in Chicago. We're able to kind of bring together different groups so that we can have intimate conversations on how to advance health equity. And so on the 17th, it will be a full day of conversations. We'll start out with a keynote address from Rena Shaw, who's SVP at Walgreens of Pharmacy Growth. And then we'll get into a few panel discussions where we'll talk about food and pharmacy deserts, and also get into advancing women's health. And we'll end with a couple of fireside chats about the frontiers of health equity and what to expect next. So expecting a wide range of panelists, everyone from McKesson, AmerisourceBergen, NACDS, even the University of Chicago, et cetera, represented on various panels throughout the day.
No, it should be a great day, and we're very much looking forward to it. Maybe you could just tell the audience how they would get involved if they wanted to attend.
Yeah, absolutely. We're really open to having various stakeholders across industries. So those who have either a mandate because their role is designated to health equity, or people who are in strategy and operations roles that really can connect to the importance of health equity and want to figure out how to ingrain it in their business more effectively. And so if you want to get involved, I think either reaching out to Chain Drug Review or Kearney, we have a website, Health Equity 3.0, where you can go and RSVP or request an invite, and you'll get more details from there. It's a free event, so it's really easy to come.
No, and it's a great event. We do encourage anyone who is interested to consider attending. Let's give the audience a little bit of a preview. I know, as you said, this is an important topic to you personally and to Kearney. Maybe you could share just a couple of thoughts about the broader issue. How extensive is the problem of health disparities in our country, and what are some of the root causes?
Yeah, great question. And yeah, like I said, it's an important topic for myself as a Black woman in the United States. There are just so many statistics that really are almost against me having a healthy life and living a long life. And so let's just take a step back and talk about how do we define health equity and health disparities. Health equity is the state in which everyone has a fair and just opportunity to obtain the highest level of health, right? And this is what's defined by the CDC. Health disparities in the U.S. is a really pervasive issue. The health disparities are defined as differences in the burden of disease, injury, violence, and opportunities to achieve optimal health that's experienced by the socially disadvantaged. And so disparities really show up in multiple ways: chronic diseases, life expectancy, poor health overall. So let's talk about some stats now that we talked about the definition. A few stats here. Black Americans are twice as likely to die from diabetes as white Americans. Native American populations experience suicide rates 3.5 times higher than the national average in the U.S. Hispanic women have higher rates of cervical cancer compared to non-Hispanic women. The life expectancy gap between the richest and the poorest 1% is 12 years. Even last year at our summit, we were able to have Dr. Ansel, and he spoke about how if you, in a certain block radius in Chicago, it's a difference of 10 years life expectancy, which is amazing and crazy to think about. So it's a serious concern, and it's very pervasive.
Yeah, no, those stats are just unacceptable, and I think it's incumbent on everyone involved in the field of healthcare to figure out how to do better.
You know, it's not just a moral issue to do better. There's a financial aspect to this, right? Like getting this right can mean more than just we have a healthy society. We have more financial stability and a better economy in the US, right? I believe it was the Tulane School of Public Health that recently had a study estimating that the cost is over 400 billion if we continue to have these disparities in place.
And that doesn't even count the missed days at work and lower productivity and those sorts of things.
Absolutely, absolutely.
Let me drill down on a couple of the panels that you mentioned. One will be pharmacy and food deserts.
Yeah.
Unfortunately, they're proliferating, especially with so many retail closures in the drugstore space that are going on these days.
Yeah.
How are patients hurt by that? How are they impacted by the lack of a pharmacy or a grocery store close by?
Yeah, so talking about pharmacy desert, so the lack of access of pharmacies can lead to medication non-adherence, untreated chronic conditions, and ultimately just worse health outcomes. This could be really problematic for seniors and individuals who come from socially disadvantaged backgrounds who can't take care of chronic diseases. And then food deserts really just piles onto that in the sense of lack of access to affordable and healthy food options. Residents really suffering from diet related conditions such as obesity, diabetes, hypertension. Studies have shown that those in food deserts likely consume processed foods at a higher rate that have sugar, fat, and salt, and just exacerbates the chronic health conditions that those individuals will face. It's a I think maybe underestimated problem as we talk about health equity. So often we talk about maybe as it relates to gender, social economic background, etc. But when you talk about the deserts and just the lack of access, it's a huge problem.
Mhm. You mentioned the gender gap. Maybe
Yeah.
you could talk a little bit about how women don't quite get as high a priority in healthcare as men do,
Yeah.
and what steps can be taken to try and close that gap.
As a black woman who has yet to have kids, like the issues around women's health care really scares me. Especially when you think about maternal rates and the rates of being able to really give birth successfully as a black woman is pretty scary. In fact, here at the firm at Kearney, we recently launched an open letter about redesigning healthcare with women in mind. And to your question around like what can we do about it? Well, when we start to redesign healthcare with women in mind, let's talk about education and training, research and policy. Those are some of the main ways where we can really start to address this. And for me, one thing I'm most passionate about is the research side of it. How can we have more clinical trials that really involve women across the spectrum where we could really start to test out various solutions for these different health issues and really start to figure out what can work for women from all backgrounds. And so I think number one is getting that research done.
Final question for you, Dominique. There have been a lot of advances both in medicine and in technology. Uh, how will those advances be applied to help solve the health equity issue?
Yeah, it's really exciting to see some of the advances in technology, seeing AI coming into play even more. I mean, AI is not new, but the real, I would say, burst of information around it and support around it is exciting. AI can really help when we talk about looking at generative AI and understanding how to reduce diagnostic errors and really improving the efficiency of care. Some of the technology that's allowing for telehealth and telemedicine that can help, as we talked about, the deserts and lack of access for individuals that don't really have sufficient providers. And even starting to really start to personalize medicine more, talking about biotechnology and starting to lead to more personalized solutions because every individual is different, right? Different DNA, etc. With that said, though, there's some things we have to watch out for as we get into AI and technology, right? The biases, the access to technology, right? Those who lack access to technology are the main ones who probably need the health support. And so that all it does is exacerbate the problem a bit more. When we've been doing a lot of our work, we've talked to various clients, and one thing that they've really emphasized is before bringing in the technology and the glitz and glam of AI, making sure that we're clear on who are we trying to solve, getting the processes right, having the right stakeholders at the table. Let's get that right and then bring in the technology. Because if you move too fast, you can really exacerbate the problem.
You have to ask the right questions if you want to get good answers, I guess.
Exactly.
Anyway, we really appreciate you giving us some insights on health equity. I know you and your colleagues and other attendees will have plenty more for us come
Absolutely.
October 17th. So we look forward to seeing you then.
We look forward to hosting it and having great conversations and bringing the community as well as the industry together.
Thank you so much, Dominique. See you soon.
Thank you.